Practitioners in Port Elizabeth in the Eastern Cape province say the widespread failure of TB patients completing their treatment makes it increasingly difficult to control the spread of XDR TB. The extreme drug-resistant strain of tuberculosis is the most prevalent in the province, and most patients battle with the stigma attached to the disease.
Ingrid Oxley was diagnosed with XDR tuberculosis in 2012, confining the once healthy sport addict to a hospital for 75 months. Her life was reduced to a daily regimen of pills, but only by adhering to the treatment and support from her family was she cured. Now she teaches students at the Nelson Mandela Metropolitan University about the disease and leading a healthy life.
If I had drug-resistant TB without taking my medication, I probably wouldn't have survived it. Drug-resistant TB can make you deteriorate quite quickly, and the medication is what helps you to be cured.
According to the World Health Organization, South Africa has the second highest amount of XDR TB patients in the world. Health authorities say people also ignore the early stages of TB, like night sweats and a persistent cough, making matters worse. This is linked to patients defaulting on their medication.
The challenge with the regimen is that we really don't have many options when we manage drug-resistant TB. We don't have those many options, and tendency has been for a patient to default or to be lost to follow-up and not be traceable. And we really are requesting this of our patients, that this is really their last resort. We are having fewer and fewer choices with treatment, that if they default with this treatment, they're actually making it more difficult for themselves to manage. Eventually, they'll become totally drug resistant.
Ingrid Oxley uses her seminars to break the stigma around the disease.
I've learned that we should love them and take care of them, because that's what they need. They need the support and being there just for them all the time.
TB is not like a death sentence. It is something that you contract, and once you have it, you have to get full support from the family, the people you work with, the people around you, the society as a whole, because the only thing that gets you going is the support and the empathy you get from people. It's the one that keeps you going.
The month of March is TB Awareness Month in South Africa and forms part of the fight against the disease. The latest research by the World Health Organization shows that nearly 19,000 people were diagnosed with a drug-resistant form of TB in 2014. Lerato Tipa, SABC News, Port Elizabeth.